Welcome to Business Connection. I'm Liz Spencer. We have a wonderful guest in studio. It's Dr. Jess Enderby, and she's a chiropractor with Phoenix Chiropractic. Welcome.
Thank you.
So Jess, tell me a little bit about how you got involved with all this.
So I got into chiropractic at a pretty young age. I got to see it firsthand with a family member, and then when I got to undergrad, I was trying to decide, which route I wanted to do in the medical field, and this kind of just steered me in the direction of becoming a chiropractor.
That's wonderful. Now, you have a lot of experience with athletes, so tell me a little bit about that.
So I treat a lot of different athletes. Anybody from, I have some Olympic athletes, some professional, elite. I have anything all the way to the weekend warrior, and yeah.
It's fun, yeah. But you're also, wanting to and are accessible to everyday people like me, and I kind of consider myself a weekend warrior.
Yeah, we need those.
You need those, and we all need a good chiropractor. Tell me a little bit about the type of chiropractic medicine you practice.
Okay, so I went to Palmer, and we did, Gonstead, diversified flexion distraction, all the things that you typically will see. Then I went on to do extended studies in Chiropractic Biophysics, which is abbreviated CBP, and with that we can do what's called structural rehab. So basically we're fixing your posture and how things are supposed to, quote unquote, be, so that we can prevent injuries and treat current injuries.
And that to me is the secret of chiropractic medicine, is that we come in and we've got a hip problem with that, but then we find out we haven't been walking right or sitting right, and that is so important, because most of us just think you're going to crack our back and make us better.
Right, which I wish I was magic and could do that.
Yeah.
It takes a little bit of work to get to that point.
Well, and tell me about some of the other types of, you mentioned the athletes, but the everyday people who might need a chiropractor. What types of typical maladies do they come in with?
They come in with, so a lot of people I see come in with a headache and low back pain, knee pain, things like that. So with headaches, a lot of times what I see is that, for being, in this day and age where we're texting all day or we're sitting at a computer, what happens is we roll our shoulders forward.
Absolutely.
And everything gets pulled. So what that does is you have a muscle that attaches from the back of your head to your shoulders to your mid-back, and what that happens when you sit like this is it pulls everything forward, so it's this constant pull on your neck, on your head, like where it inserts, and then it can also affect shoulders and everything like that.
I always find it fascinating that I may come in and say, oh, it's my hip, and I find out, oh, it's really my back.
Right.
Or I come in and my neck hurts, and it's really a knee injury I had years ago.
Yep, I see that all the time.
Because the body is so intricately put together.
Yep, everything works together.
Everything works together. So tell me a little bit about, you also help with diet and fitness. So I would think that would be a natural fit with you.
Yes, I love it. So fitness and diet. So fitness, when you come into my office, what I do is I do basically a functional exam on you. So I see, how you do, a squat, how you do just range of motion in general, and I attribute that back to the exercises that we need to figure out what you should be doing at the gym, so you're not just guessing. Some of my patients, I even will go to the gym and show them how to do things, so I'll take them to where I go and teach them how to use some of the things, but I also do have personal trainers that I can send people to, so depending on what your goals are, I'll kind of pick and choose where I think would be a better fit. And then diet, I don't do any diets or weight loss or anything, but I do teach you the tools you do need to hit those goals. So I always rope those into general health. So with diet, I will teach you what foods you should start to incorporate and little things you can take away. I also put on these little events called Shop with a Doc, so you can come.
I want to go shop with you.
So you can come and I can show you, what ingredients you should look for and stay away from, and what you should buy organic, what you shouldn't, because I think everything's always changing and we never know, what's the right thing now.
Right. Well, and so many things are changing, and that's where I think it's nice to have you have to keep up with it. Even in chiropractic technique, I mean, we see people walking around with tape on and all this, and cupping in the Olympics, and we wonder, was that something that would help me?
Yep.
And so it's best to kind of just go have you figure all that out.
Right. That's my job.
That's your job, right?
Yep.
We won't play it on the side there. And what's your age range of who sees a chiropractor?
I see everyone from babies to, 90, 100-year-old patients. So I would say I mostly treat middle-aged people to, 20, 30, 40, 50. But I do see the latter ends as well.
That's great. Because I think a lot of us, especially when we pass that midlife mark, and we're athletic, we find ourselves limping or having because our youth, which has compensated for our body for so long, is now needing some help. Would that be a fair statement?
Yes, your body's catching up to you.
It is. Well, and that's where I think a chiropractic relationship helps. So if someone wants to come in but they're not quite sure what they need, but they want to come in and talk to you, is that someone you welcome?
Yeah, I have people who actually sometimes will just stop in to say hi, like, hey, I saw on Facebook, you posted something on nutrition or you posted a workout, and I just had a couple of questions, and I'll explain that. Like, I see those things all the time.
Right, because I think it's important, and you are just so approachable, to have a good relationship with your doctor.
Agreed. I think that's the only way you're going to hit the goals you want to hit.
Well, that's the only way I think you're going to also share and tell the truth to your doctor, because I think a lot of people kind of, I hate to say, lie to their doctor because they don't want them to know that they're eating poorly, or my foot really does hurt, but I was stupid and I twisted it, so I'm going to tell you something else.
Yep.
Yeah.
And I see a lot of stuff on X-ray when I'm looking at X-rays and I'm like, I'm surprised you don't have this going on, and then they're like, oh, well, I do. Like, just the other day I was saying, this girl came in and she was saying that she had low back pain, and then sometimes she gets headaches. It's just a normal headache, and I was like, headaches are common, they're not normal. So anyways, I was going through it, and I was like, we looked at her curve in her neck, and it told me all these things, obviously, because everything tells me something when we do the exam and when I look and I compare the X-rays. And I was like, I'm surprised you don't have numbness and tingling in your hands. And she's like, oh, I do. And she's like, I didn't know you could help with that. I was like, yeah, absolutely, we can help with that.
Well, it's true. I don't think we spend enough time talking to our doctors.
Agreed.
Because they're busy and we're hesitant in that. When we first come into you as a new patient, do you do a full set of X-rays? Is that something that is standard for you, so you can take a look at what we got going on?
Yes, because I do the structural rehab, I have to see exactly what's going on, because something could be muscular, it could be structural, so I just need to know if a PT is where you should be or with me is where you need to be.
And so with that structural rehab and that, so you mentioned PT, you can work with a variety of people. You work with my physical therapist, my trainer, you recommend a trainer, you are you kind of get me all pointed in the right direction.
Yep, my goal is to get your health goals checked off.
That's awesome. Jess, thanks for stopping by and sharing all that you do with us. You're a wealth of information, so we thank you for that. We're going to be right back with more Business Connections. Stay tuned.